actually then we're going to go into the goals, because I'm sure you are come here for the purpose of you coming here. And my goal would be to align my talk to your goals. So my name is Nadia Ali, and my journey started with my med school. I did my med school from the Aga Khan University in Karachi, Pakistan, which is apparently the Harvard of South Asia. Then I came here for my residency. I did my residency at Drexel University. And following that, I did my master's in public health from Hopkins. After that, I was at Penn as an academic internist, and then I went to Kosher to be the associate program director for internal medicine residency program. That was the time when I actually went from an internal medicine position to an integrative physician after my own personal crisis, health crisis, and I'm currently practicing as an integrative, holistic, functional physician in Brentwood. And today we are going to be talking about something which is, I don't think I have to ask anybody if you have stress or not. I mean, it would be naive to think somebody's living without stress. And then two other things are anxiety and depression. And what we will talk about is, we are not going to talk about the usual stuff, like how if you ask somebody depression or stress, they'll keep on going about their symptoms, which we kind of know. And then most often a conventional approach to that is that you patch it with some kind of a medication. And our goal would be not to try and look at it from a conventional standpoint, but our purpose is to understand the why of it. So if we can understand the why, we don't necessarily have to patch it with something to improve the symptoms, but really to understand if we can remove some of the basic causes of the depression and anxiety and stress. So before we go on, I wanted to hear from you, just a one-liner. I know there are a lot of people, so I don't want to spend too much time doing that. But what would be your primary goal? If I were to ask you a one-liner to tell me exactly what is it that you would like to get out of this an hour that you're spending here today, which I think is the most valuable thing that we potentially have our time. So a one-liner.
I'm a mental health counselor, like whatever to help you with your clients.
Perfect.
I'm in mental health too, for people 60 and over with COSLA, and I want to be able to help some of my consumers, my clients, as well as for personal reasons.
How to handle the depression since my husband died.
Just seeing how all these come together.
To understand techniques.
Strategies. I think it's more once you have stress and anxiety and you're within the stress and anxiety, how to make it go away.
I'm a wellness coach, so seeing a lot more of the stress, like a lot of people want to lose weight, and you're really connecting the full stress and like sleep and all that together.
I'm a wellness coach as well, so for my clients and myself.
And I'm also a wellness coach and the same strategies for my members.
And I'm a caregiver, and I really know how to deal with someone that has depression and distress from how to deal with it. I'm responsible.
Okay.
I would just say the techniques, understanding it.
How to deal with it.
Mm-hmm.
Just management of stress techniques.
Okay. So very interestingly, there was a term that was used many times. There were some people who used the word management. There were some people who used the word strategies, right? And it's the reason why I'm stating those words is those words are important because this is the way conventional method work. So if I tell you, or if I go to a physician and I say, I have high blood pressure, what do I do? And the doctor will say, okay, you remove salt and this is a medication that you will take, and then I will do this blood work, and then you come back to me, and then we'll see if your blood pressure is better or not, right? So the way we have, this is the approach, which is how we think now. So I have a problem, so what do I do about it? But I think I want you to step back. Just step back, and if this patient comes, he says, I have blood pressure. What if the doctor says, why do you have high blood pressure? Well, I mean, there are so many people your age, but they don't have high blood pressure. How come you develop this high blood pressure? What's going on with you? What is it about you that, what is it that you're doing or not doing that is causing high blood pressure? So I'm not going to give you a pill because, we first have to figure out why. And once we know the why, then we'll give you something which would remove the cause of the problem. And so the difference, the one thing I want you to understand that there is a difference between a conventional approach and an approach which we call the functional approach, or some people call it integrative approach, some people call it holistic approach. So you can pick your term. But the bottom line is that you have to step back and you have to look at yourself and you have to ask, what is it that has triggered this problem? When we talk about depression and we talk about anxiety and when we talk about stress, right? These are merely terms that are used for particular symptoms. So if I ask you stress, your definition is very different. You might say, oh, I just don't feel like doing anything. And if I ask her, she would say, I just don't feel like eating. And if I were to ask another person, said, oh, I feel like a brain fog. I just can't concentrate. So, and it's the same thing with depression, same thing with anxiety. These are basically terms which are given to lots of different symptoms. And everybody will have a different set of symptoms. However, everyone will have a very different reason why they have that symptom. For example, one person may have that symptom from an imbalance in a particular organ in their body. For example, brain. So somebody will say, well, maybe my brain is not functioning. But what is in your brain that is not functioning? So we are going to go into the depths of what is it that predisposes you, that gets you to the point of getting stressed out, anxious, and depression. Because there are other people who are in exactly the same boat as you, but they don't necessarily end up being as miserable as you are, right? So the question is, what is it that they're doing differently, and why did you reach this state of health? Okay? That is our goal. You can definitely ask me questions, stop me anytime. One of the issues with being a doctor is that we tend to throw terms out, and people don't understand those terms. So I would encourage you that if I use a term that you don't understand, don't feel bad, because it's bad on my part to have thrown out a term. And so you should be able to kind of question me and say, what is it that you mean by that? So that's perfectly fine. So, all right, so we talked about the goals and the objectives. So we'll briefly talk about the symptoms, and I'm not going to talk about the symptoms, they're psychological. I'll talk about more of the other symptoms. What organs are involved in the process? What is the process of damage when we talk about stress, anxiety, depression? How are we going to assess the underlying cause of the problem? And then we'll talk about mindfulness with stress, anxiety, and depression as a tool. So what is health? So if I were to ask you, how many of you consider yourself to be healthy? You can raise your hands. Okay, all right. So it's interesting that, you are here for a particular problem like depression or anxiety or stress, but we still call ourselves healthy. So why is that? Then we have to ask ourselves, what is our definition of health? So if I were to ask, I think I missed this entirely. I don't know about with regards to the info. I don't remember your purpose for being here, but why would you say you are healthy? What is your definition of health?
I feel good physically,
Very
emotionally,
Uh-huh.
I have a sense of well-being and purpose, you know, I have a meaningful life.
Good. So I'm glad that you said that, because you will find a lot of people around you who will call themselves healthy because they either are not on medications or they're not diagnosed with a disease, but that is not a definition of health, right? So the fact that you have a spiritual well-being, emotional well-being, and physical well-being, that is what defines health. So if someone is really stressed out, then they cannot call themselves healthy, even though from a medical standpoint they're neither on medications nor do they have any diagnosis yet. But the World Health Organization defines health as a state of physical, mental, emotional, social, and spiritual well-being. So when you look at health, you look at it from that perspective. And one of the questions is, why is it that we are incorporating the social and the emotional and the spiritual into health? It's really the question, why is World Health Organization including those? Is because those have a direct impact on your physical diagnosis and your physical health as well. So what we're talking about is something very important, because even though it's just emotional, because a lot of times if you remember there was a time mental health was not even covered. Now under Obamacare it's being covered, but it was not covered because health was considered to be something where you were physically ill. If you're mentally ill, it was like, okay, fine, you have some depression, it's the big deal. But it is a big deal. And the fact that you're here kind of tells me that you kind of understand that to some degree. So we talked about this, social, intellectual, spiritual. So the concept of stress. So one of the things I want you to understand is that we often undermine stress. The issue is that now we know that stress, whether it's a physical stress or is it emotional stress or any type of stress that you have on your system, has the capacity to affect every other system. So what do I mean by that? So, stress is often associated with emotional symptoms, but I think that is the least of the problems. A lot of those people who have stress or stress-related issues, whether you talk about depression or you talk about anxiety, also have a lot of trouble with maintaining any kind of relationship with the people around them. And to the degree that sometimes they might even have trouble staying at a particular job. Intellectually, a lot of people who suffer from stress, anxiety, or depression may actually have trouble making decisions. They will have trouble getting the tasks done that they were able to do before. They might be taking longer to do them, or they might feel that they just get very exhausted at the end of that task. Spiritual. Very interestingly, there are a lot of people that I see in my practice. If you were to look at them from a material standpoint, they would tell you they have everything one can imagine, from a house and children and grandkids and everything, but they are not happy.
Right.
And it is very interesting that one has to ask the question that what is the missing link there? The missing link is that the spiritual connection is missing. And spirituality is very different from religion. So I just want to make this clear, that this is not about having or not having a religion. A religion is a path to spirituality, and you can be spiritual even when you don't have a religion. So it is about how connected you are with your soul. That has a very important role with how well you deal with stress as well. And then physically, we talk about chronic diseases. Chronic diseases are diseases which are there for the rest of your life, is how the physician would tell you. Whether you talk about diabetes, you talk about heart disease, you talk about cancer, we have a lot of data now which clearly links stress to all these issues. So we know that the burden of stress is huge in terms of what it does to people. Alright, so basically, like, how it manifests itself. And we have kind of talked about it, that it manifests itself in physical symptoms, emotional symptoms, social issues, and spirituality. Now we're going to talk about the organs. Interestingly, when we talk about stress, anxiety, and depression, people think that the most important organ is the brain. Unfortunately, it is not the most important organ. Can you think of any other organ that you think might be involved in anxiety, stress, depression?
Heart.
Heart?
Stomach.
Very good. Excellent. So one of the systems is your gut. And we'll talk about what is the relationship between the brain and the gut. Anybody else with any other systems? Any other organs?
Pituitary.
Close.
Thyroid.
Thyroid, correct. Anything else?
Back.
Spleen.
No.
Close.
This, what's that, your spine. Your bowels.
They only talk about the gut.
Oh.
The gut we talked about. Yes. What else?
How about joints?
Adrenal gland. Adrenal gland. We'll talk a little bit about how is that related to your stress. The gut, we talked about the gut. The ovaries. For women, very important organ. How many of the women become unbearable during their periods or around their periods?
Oh, God.
I used to. And the poor husband. So, thyroid, somebody mentioned that. And liver, one of the very important organs, plays a very important role in stress, anxiety, and depression. All right. So we're going to talk about each of the organs. So the first thing we talk about is the brain. So unfortunately, the organ is merely the messenger. Okay? And so when we talk about depression, we talk about anxiety, we talk about stress, we talk about neurotransmitters. So if you ever talk to a physician or a healthcare person, they will tell you, well, this is the problem. You don't have enough serotonin, you don't have enough dopamine. What are they talking about? Serotonin and dopamine are chemical messengers in the brain. And they are the ones that help the brain communicate. So the cells of the brain communicate with each other through chemicals which we call neurotransmitters. Okay? And so when somebody has depression or anxiety, they get medications. The medications actually, what they do is they try to increase certain neurotransmitters like serotonin, like dopamine, and try to decrease other neurotransmitters. Okay? That is how the drugs actually function in these people who have depression or anxiety kind of issues. Okay? Now, the two neurotransmitters that I'm going to talk about are big, I mean, in terms of their role that they play. So one of them is serotonin. Serotonin plays a very important role in not only mood, but also appetite and sleep. So remember, there's some people who will say, I'm an emotional eater. What do they mean? When they're really upset, they're going to either eat too much or they will not eat. They will feel hungry or they will not feel hungry. Or sleep. Like a lot of people will tell you that I can't sleep because I feel depressed, or I just can't seem to fall asleep. I keep on waking up, and it's just not the quality sleep that I would like. And so serotonin plays a very important role in that. And then dopamine. Dopamine is involved in motivation and pleasure. And it's also involved in memory. So a lot of people who are depressed will not have a very good memory. And they will forget things. And the reason is because, like we said, that the ability of the brain to function effectively is affected. They will also have something called restlessness. They're very fidgety. If you see a lot of people, if you know if they're constantly like, you know, if you see a speaker constantly doing this, it means that person is nervous. They just can't stop. Or sometimes you're sitting in your seat and you're still moving here and there because you're just like anxious. They also, there's going to be issues with sexual issues, like, you know, you're not in the mood.
If you want to.
Right? That's
You sure?
something that happens a lot to people who are stressed out, they just don't feel, they don't have a libido. And then restless leg syndrome is another thing that dopamine is related to. The interesting part about these, especially serotonin, was there was a very important experiment that was done in Cambridge. And what they did was they took two groups of people. And what they did was, to one group, they changed the diet of those people such that the building blocks of serotonin. So the way our bodies make serotonin is it requires certain amino acids, right? And it requires certain nutrients. So they did not purposely give those nutrients and the building blocks to one group, and the other they were like letting them have whatever they needed or whatever they needed for making serotonin. And at the end of the experiment, they found something very interesting. They found that the people who were not getting the nutrients needed to make serotonin were becoming really irritated and really angry. And they found that when they looked at the brains of these individuals, they found something very interesting. So there are two parts of the brain. There is a part right here, which we call the frontal part of the brain. And then there is another part of the brain on the back side, which is called amygdala. So the frontal part of the brain is the brain which thinks. So it's very objective, very calculating. And the amygdala is the primitive part of the brain. It's the emotional side of things. So what they found was that these people, their connection between the amygdala and frontal region was actually breaking down because they did not have serotonin. So what happened was, so when something happens to us, right? When let's suppose something bad happens or we get a bad news that this might happen, there are two ways somebody's going to react. One is, well, we'll have to figure out what we're going to do about this. I'll have to think through, come up with a strategy. The other is, oh my God, what's going to happen? Oh my God, this is real. So you get really emotional about it, right? And you stop thinking about what's next. Are you going to think about it? This has not even happened. Why don't we just sit back, relax, and kind of look at what are we going to do about it? So they found that these people were not able to use their frontal, their thinking ability, because the emotional brain was taking over. So there were two things that I want you to understand from this study. First, that a change in diet changed the levels of serotonin. It's very important. And the second thing, which will even make you even more surprised, is that serotonin, most of the antidepressants, it's a multi-billion-dollar industry right now, is the antidepressant medications, which we call SSRIs. These medications work by increasing serotonin. The sole purpose of these medications is to increase serotonin, and that's how people feel better. It's only effective in 30% of the people, but it does work in 30%. 90% of the serotonin in our bodies is present where? Correct. So 90% of your serotonin is present in your gut. So the question is that, how can we deny the connection between the gut and the brain when the neurotransmitter which makes us happy is sitting in the gut? So again, the neurotransmitter is used in the brain, but it's made in the gut. So that is a very important thing to remember and understand when we talk about the root causes. All right. Then the gut came, as we probably just talked about the gut. So we have the gut here. Anyone who knows what's microbiome? Anybody wants to take a stab at it? Excellent. So microbiome is the name to the bacteria in our gut. Now, this is the newest organ in our body. And why do I say it's the newest organ? Do you know how much do these bacteria weigh?
I'm sorry, could you ask the question again? How much does it weigh?
Yeah. If you get all your bacteria and you kind of figure out how much do they weigh, what do you think is going to be?
5 pounds?
So what?
5 pounds.
No. 2 to 3 pounds.
Oh.
So we are all carrying 3 pounds of bacteria. And for every cell in our body, how many bacteria do we have? 10. For every one cell, you have about 10 bacteria. And for every single DNA that we have how many bacterial here? 100. So we are more bacteria than humans because we have more bacteria. We have more bacterial genes, right? So an interesting thing is that these bacteria are not sitting there quietly. They're talking. They're talking to each other. And who else are they talking to? They're talking to your brain. They're talking to your hormones. They can change the level of your hormones. They can change the level of your neurotransmitters. And now we know that a lot of these bacteria are involved in processes which are called autoimmune diseases, like thyroid disease, like multiple sclerosis, like diabetes, like cancer. So these bacteria are really running the show. And so nowadays, if you go to a psychiatrist, you will be surprised when he may give you a probiotic and say, well, this is going to help you. And you're like, I'm not too sure. But this is the reason why he would do that. So I know I'm throwing a lot of new concepts here. I just want to make sure that I'm going at a pace that you guys can understand. Is this a good pace?
Yeah.
I have a question though.
Sure.
We said with all the bacteria that we currently and stuff, is that why we should have good bowel movements to get that bacteria out? Is that,
So you want the bacteria.
or you want it?
You want it. Because they're the good ones. So if I tell you that a baby, a baby that is born from C-section versus a baby born from vaginal delivery, there is a difference in what diseases they will develop. And the reason is what?
Because they pick up bacteria when they're born.
Excellent. In the 3rd trimester of pregnancy, the flora, the bacterial flora of the vagina of the mother changes such that it has the kind of bacteria that you need for the baby's gut. So the baby is supposed to swallow the vaginal secretions. So it gets the good bacteria. Babies born via C-section, unfortunately, are born in a sterile environment. So those kids are more prone to developing autoimmune diseases because they start with a gut which does not have the right bacteria. So they are your friends, but they can become your enemies too. And the question is that how do you make them your friends, or how do you retain the good ones and get rid of the bad ones? Okay? So good question. All right. Well, we just discussed that. So what do I gut bacteria do? All right. Then we talk about the adrenal gland. And so what I want to tell you is that how many of you know about the adrenal gland? A few of them. So I'll give a small intro to the gland. So what organ is this? Oops. I touched the wrong thing? Oh, it's a smart screen. All right. So you look at that cap. The cap, that's the adrenal gland. It's a teeny-weeny gland sitting on your kidney. Very important gland. Basically, there are two systems in our body, the sympathetic system and the parasympathetic system. Sympathetic system, the layman term for it is flight and fright, right? So it's like when you have a dog running after you, the sympathetic system is going to go up, and your like blood pressure goes up, and your heartbeat, and you're supposed to have that because you really have to run. And then the parasympathetic system is the calming system. So when the dog is gone, your body's like, okay, let's get back to normal. Blood pressure comes down, heart rate comes down, you feel better. Oh my God, I feel so much better now. So the way it's supposed to, the way humans are evolved is such that we are supposed to have some moments of sympathetic activity and more of parasympathetic activity. Okay? And what happens is that one of the hormones that is released by adrenal gland, the sympathetic system, is the cortisol. Okay? So the cortisol is a hormone that actually does a very good job when you have a real sympathetic, you can say, activation. But if this cortisol remains in your blood for a very long period of time, it causes all kinds of problems. So how many of you know about the steroids? So the steroid is a sister to cortisol. So you know how doctors will say, oh, we can't give you steroids, and they can cause this, and they can cause you bone loss, and you can get diabetes, and your immune system is going to go down. That is exactly what cortisol does. So when you have a lot of stress in your body, what happens is the system gets activated. So it's like when we get a food processor, there are instructions in it. You cannot run it for more than 1 minute. But if you press the button and you forget it to turn it off, you come back after half an hour. What do you think has happened to the processor? It's done. You better trash it. And the same thing happens, that when we are stressed out and we stay stressed for a very long period of time, then what happens is what we call an adrenal fatigue. The adrenals are like dead. They can't function. And if they cannot function is when, people will say, I feel tired all the time, I just don't feel well, I just don't feel happy, I just feel exhausted, I have no energy, I just barely can get out of my couch and barely do the things I have to do because I have to do them. So that is a point of adrenal fatigue where the system is completely burned out. And there are many stages to getting to that point. You don't start off with that, but you end as that. But your initial symptom is real, a lot of stress symptoms, and then they kind of progress. So this is a very important organ that plays a role in your stress. It's very interesting that what I've listed here is IL-6 and TNF. These are actually markers of inflammation. So when your sympathetic system is running for a very long time, the body gets into a state of inflammation. And the IL-6 and TNF are markers in the blood, which if you measure, you will find that these are elevated in people who have depression and anxiety. So it is very interesting because you will find that these people have CRP, C-reactive protein is a very important marker. It's a marker which is very interesting because there's a lot of research now which tells us that people with autoimmune diseases, heart disease, have very high CRP. But people who are depressed and anxious also have high CRP. So the common link is the inflammation which is really traveling through your body, and your brain is really inflamed. Your brain is really on fire when you're going through this major stress and depression and anxiety, and you can see that when you do your blood levels of inflammation markers. All right. Okay, this is the other organ, liver, which plays a very important role. Now, if you look at the liver, they have found that people who have liver abnormalities are at a very high risk of developing insomnia, depression, as well as anxiety. Why? Because the liver is, you can call it your cleaner. Okay? So anything that goes to your body first goes to the liver. The liver is basically your security system. It says, well, this is good, this is not good, we need to change this. And so when everything is good, then it sends it to the rest of the body. It says, well, this looks like it's clear security. You guys can all have it. And if it's not, it will say, no, no, it's not going in, you've got to get this out. That is really the role of the liver. And so when people have abnormal liver tests, what it's telling us is that the liver's ability to clean the system has been affected. And when it cannot clean, then all the junk is going out. And that can affect our ability, the ability of our brains to function. So what are some of the things which can affect the liver? So diet plays a very important role in terms of affecting our liver function. So how many of you have taken Tylenol? So what is one of the most important and common cause of liver failure?
Over-the-counter medicines.
Tylenol affects the liver. Too much Tylenol affects the liver. Again, there are lots of medicines which would have Tylenol and we think it's just a Tylenol. But it's not just a Tylenol.
It's a leaf too. My doctor said it's a leaf.
A leaf works, it affects the kidneys. So, alright. So then we have something called xenoestrogens. Obesity affects the liver, and then alcohol affects the liver. We all know that. I'm going to be talking about xenoestrogens. Yes.
How does cortisol affect the liver?
Well, cortisol basically affects the liver indirectly. Cortisol causes a state of inflammation. So if you have inflammation, it's going to go anywhere and everywhere. And it depends on what's your weakest system, which will be the one that will be first affected. So for example, if there is, God forbid, a bad event that happens in a family, you will see that every member will be affected differently. One will actually have a cold. The other one is going to get a headache. The third one is going to have diarrhea, and the fourth one is going to have a heart attack. It was the same event, but everybody manifested differently. Why? Because the weakest system got affected. So the person who had a heart disease problem anyways got a heart attack. The person who had low immunity had an infection. The person with a weak gut got diarrhea. The person who had migraine history got a headache. So it will affect you depending on your weakest system. So anyone know what are xenoestrogens?
I heard of it.
Xenoestrogens are estrogens, but they are outside the body. For example, the receipts that we get, the shiny receipts, they have certain chemicals which act as estrogens in the body. There are lots of pesticides, there are lots of things in the environment, like women use lipsticks and cosmetics, and we use this perfumes. All these chemicals, there are lots of chemicals which have the impact of estrogen. So we are bombarded with estrogens from our environment. The problem is that when you have all that estrogen exposure, your estrogen level is affected, but the main issue is that your body does not know how to get rid of those estrogens. It can get rid of the natural estrogens, but these estrogens it doesn't really know how to work with. And that creates a lot of issues. Remember that we have estrogen receptors in the brain as well. So it does affect the brain as well. All right. Well, hormones, we talked about hormonal imbalance. So the hormones that affect or have the possibility of causing stress, anxiety, depression are estrogen, progesterone, or androgens. Any imbalance in these hormones can cause a problem. Thyroid hormones, imbalance in thyroid hormones can predispose to mental illness. And endocrine disruptors, again, these are xenoestrogens. They are present in the environment, we're exposed to them, and then they actually act like estrogen, and they break down our hormone system. So what is the process of damage? How do we get damaged when we have stress, depression, or anxiety? So, number one, there is imbalance in neurotransmitters. There's hormone dysfunction, there's gut dysfunction, and there's liver toxicity. We talked about all those. And what is the underlying cause? Why do these dysfunctions happen? So the root causes of the issues are, number one, nutrient deficiencies. Because serotonin, in order for your body to make serotonin, it requires magnesium, it requires zinc. For making dopamine, it requires copper, and there are lots of other vitamins which come into the picture that you need to be able to make your neurotransmitters. Infections. So there are lots of infections. If you have a chronic infection, for example, some people have Lyme, some people have infection of their gut. There are hidden infections which can be there, which you may not be aware of, that are causing chronic inflammation, which is going all over your body, including your brain. Toxins in the environment, food sensitivity. You will find people who will say, when I eat this, I just don't, I feel really tired after eating this. What made you get tired after eating a certain food? Food sensitivity. There are certain foods that you will be sensitive to. When you eat them, they directly affect the ability of your brain to function. It is not the same as food allergy. Food allergy is when you eat a food and suddenly you find like you're choking, your tongue is swelling, you get a rash. That's allergy. I'm not talking about food allergy. I'm talking about food sensitivity.
Thanksgiving.
Sorry?
Thanksgiving.
Thanksgiving.
Like if you turkey.
Right, correct. So, sleep. Sleep, very important in terms of its ability. So, a lot of people who have chronic insomnia, meaning they have not slept a good sleep for years, you will find that these people are more predisposed to diabetes, their blood sugars are going to be off, they're going to have a lot of other issues because the sleep is the only time when your body gets to heal itself, because you're using your body the entire day. So it's the night time the body really relaxes and it tries to kind of get back to doing what it's supposed to do to replenish itself. So if you have issues with sleep, yes, your brain will be affected. And those of us who can't sleep at night for 1 or 2 nights, they know how in the morning, their mood changes and the way they work changes. A lot of things change because you can feel that you're getting irritated more, you're feeling agitated more. Plays a very important role. Stress. So when I say stress here, I mean an actual stressor. So, we all have issues in our life, whether it's relationship or whether it's somebody who we're trying to take care of. And when we have that stressor has the ability to put us in a difficult situation. And it can affect our brain. But remember that this factor will affect you much more if any of the other factors is not in line. If the other factors are in line, then the single stressor may not necessarily destabilize you. But if there are a lot of other factors in addition to the stress, then you're going to have a real issue dealing with the stress. And then immune dysfunction. So immune dysfunction is simply the ability of our body to deal with the stuff that's coming in. So whether it's infection or it's to protect us from the environmental toxins, if our body cannot do that, then we definitely are going to have a much bigger problem in terms of mental illness and physical illness, both. Alright, so now we're going to talk about functions. So let's suppose if you go to an integrative physician with a problem, like, okay, okay, I have depression, I have anxiety, I have stress, what do I do now? How is that approach going to be different from if you go to a regular physician who will give you a medicine? Okay, so this is a functional approach to depression and anxiety, or to any kind of mental health illness like ADHD. So the first thing is the purpose of the integrative program is to understand what is the root cause of the problem. So the first thing will be to do an assessment. What is the physician going to be assessing you for? He is not assessing you for, what your symptoms are, because if you already know that you have depression or anxiety with your symptoms, he's trying to look outside the box and see what are the things that might be putting you in the wrong place right now. Meaning, symptoms that indicate there is a gut problem. Gas, bloating, constipation, diarrhea, pain, nausea. Frequent, nose infections, sinus infections, indicating that you have low immunity. These can all be the causes of why you are getting into depression, anxiety, or, a high stress mode. He's going to ask you about muscle and joint pains and aches because they are an indicator of inflammation. Autoimmune diseases. If you have one, it's a big indicator that there is inflammation going on. Irritable bowel syndrome and leaky gut. And then small intestinal bacterial overgrowth are all the things he is going to want to know in order to understand what is your root cause of depression, anxiety, ADHD, etc. So then there's the ways you can assess your inflammation in the blood. So he's going to order lab tests. There are two types of lab tests. There is the regular lab test, and then there are special tests called functional tests. The special tests are usually done by a functional or integrative physician. And what they tell us is they tell us exactly what are the bacteria in your gut. So you can understand what the problem is. Or it will help them understand the active hormone levels. So the liver function, the food sensitivity testing is another testing that we can do to understand what foods are we sensitive to. We talked about the hormones. All right. So what is it that you need to improve your stress, anxiety, and depression? The first thing is you need an assessment to know what are we missing here. The next thing is to treat, and how are you supposed to be treated? The first thing is to know what is your nutritional level so we can replete your nutrients. The essential fatty acids and the amino acids. These are what your brain needs to be able to make the neurotransmitters that you need to be happy or to feel happy. Microbiome. You will need to fix your gut. You will need to detox to get rid, to help your liver's ability to get rid of all that you have been exposed to. And then the most important thing is to get an individualized diet plan, because every one of us is different. So it is not possible that the diet that's good for me is the diet good for you. Because I may be sensitive to X, Y, and Z, and you may be sensitive to A, B, and C. So we need to come with what is going to be our plan and what is it that you need in terms of the nutrients that will really dictate what your diet is going to be. And then hormone balancing. If there is an imbalance in hormones, we have to fix that, especially if your cortisol is up or imbalanced. And one of the techniques that we're going to do briefly is called mindfulness. So mindfulness is not really addressing the root cause, but mindfulness gives you a tool that while you are working on all the other things, you can help your mind focus. So anybody knows what exactly is mindfulness?
Remembering stuff?
I'm
Is
sorry,
that part of remembering?
remembering,
Paying attention to what you intend to do.
correct, paying attention to what you're doing,
Being present in the moment?
very good. So the idea of mindfulness is that you have to be in a state of consciousness, but you have to not be thinking. to understand. But basically, it's a state where you are focused in the moment or in what you're doing. So let me give you an example. Imagine if you are doing, let's see, maybe we can do an exercise here so we can kind of see what it feels like. For a moment, I want you to close your eyes. You can listen to this first, then you can do that. I want you to close your eyes and then listen to your brain. You will hear a lot of thoughts, and I want you to pay attention to those thoughts. So you're going to close your eyes, and you're going to do that, and you will tell me what exactly did you think was happening inside your brain. So let's close our eyes and let's see what we So you can open your eyes now. How many of you actually could see what's going on in their brain? How many of you felt like you had a lot of thoughts? Some thoughts? No thoughts.
Too much external noise at your air conditioning. And you close your eyes, you can also hear your pulses beating.
Right. So interesting that you actually heard what was going outside. Okay. What other things did people experience?
I was just thinking what I had to do next, like thinking forward and, what's.
Good. Good. So thinking forward, what am I going to do?
That's what I would think it too in the future.
Right, of the future. Okay. Anybody thinking about the past? No. Anybody feel they had no thoughts?
I was just thinking, listen to your thoughts. I just kept hearing thinking, or I just kept hearing listen to your thoughts in my head. But I wasn't thinking about anything else. That's great.
So what I'm trying to tell you is that, it's very easy for us to kind of say mindfulness and do mindfulness. It's very difficult to do because a lot of times we don't even know what's going on in our brain. So, like if you clearly know that you are having thoughts about the future, that what you're going to do and this is what I'm going to accomplish, it is very clear that that what is this is a very surface. The most frequent thing that people will tell you is what they want to do next. Because this is where most people live. We live in the future. So we don't live in the present. But this thought that you're having is a very cursory thought. There is a thought which is below that, which is the actual thought, which creates your mood. It is below the surface. So mindfulness requires practice. So the first thing I want you to do, the easiest thing to do mindfulness is to pay attention to what you're doing. Have you heard of mindful cooking? So what is mindful cooking? That when you are cooking, you are not just cooking, that I just want to finish this off because I have to do laundry too. The idea is that you are really paying, you're folding, the color, the smell, everything you are experiencing. Whenever we do anything, we're always in a rush. We just want to finish it so we can get to the next thing. Which is precisely what we talk about the processor. The mind is running all the time. The idea is that you stop looking at the watch and you say, I'm just going to do this. So that is the idea of mindfulness. So when you are walking, when we are walking, let's suppose we go for a walk, we are still thinking, oh, you know what I have to do next? That's not mindfulness. Mindful walking is when you're watching around you, the tree and the birds, and you're really paying attention. It may be difficult at first, but it is possible that you can be mindful in anything that you do. You can do anything mindfully. So the key is to do it slowly. The key is not to look at the watch. And the third thing is to actually do it from the heart. A very good way to start is to do what we call mindful breathing. And we can do a little bit of mindful breathing. So what we do is, we are going to, so first I want to ask you, deep breaths are taken from the chest or the stomach? Very good. So what I want you to do is to place your hand on your stomach. Do you feel your stomach moving? No. Good. Which tells you that our breaths are shallow. Right? Because when we breathe, when we do mindful breathing, the stomach is supposed to move out and in. So you're going to close your eyes, you're going to take a deep breath and feel your stomach going out. And then you exhale and move it in. And you do that for 5 breaths. So how many of you could actually do it without? Okay, good, good. How many of you had thoughts when you were doing it? Okay, which basically tells you that that was not mindful breathing. Because in mindful breathing, your attention should be really on the breath. And so you just have to feel the air going in and feel the air coming out. And so your attention is so focused on the breath that you're unaware of what's going on around you. If somebody tells you I was doing mindful breathing and I could hear the machine there, that person was not doing mindful breathing because he is listening what's going on. His attention is somewhere else, although he's doing apparently mindful breathing. So the one thing I would suggest, if you want to start something today, this technique is really a good technique because when we breathe, our diaphragm moves, right? The diaphragm has the vagus nerve in it. And the vagus nerve actually activates your parasympathetic system, which is a good system. And once your parasympathetic system is activated, it automatically suppresses your sympathetic system. So if you can start with 5 breaths a day and increase it by 5 breaths on a daily basis, you want to have a 20-minute mindful breathing every day. You will feel a huge amount of difference in your level of stress. So that is one thing I would definitely recommend. And one second. And so this is my last sentence since we're finishing this, is that if you are having elevated level of stress, or if you're having depression, or you're having anxiety, I want you to really get to your root cause. Because remember that mindful breathing is basically, again, a technique which will help you, but it will not help you overcome the entire thing. And if a major stressor comes, then you will not be able to do the mindful breathing, just because the stressor can overwhelm you. So really the key is to understand what has caused the problem in the first place, and then do the mindful breathing to kind of calm your system down. Yes?
When I go to a doctor's office, I'm generally in a rush to get there in time. Then I have to sit in the waiting room and wait. So I've been doing that, I don't know where I learned it, but I do that type of breathing, and I put my hands on my lap, and out I go until I hear my name called. When I go in, my blood pressure is perfect. My pulse is perfect. I don't know why I went to the doctor in the first place.
So this is actually a natural way of doing it. Why? Because remember we say when we are stressed out, we sigh. That's a natural way your system works to kind of help you. And so when you're doing the mindful breathing, you're actually just using your natural response, and you're doing it in a calculated way to help you. So I think you're doing a good job by doing the mindful breathing and getting your blood pressure down. Any other questions? Here are some of the here is an introduction to what I do as well as what functional integrative medicine is if anybody is interested.